everyone, welcome to my channel. In this video I'm going to talk about how we deal with the depression and anxiety, which is the major concern nowadays. So first of all, what's the anxiety? Anxiety means characterized by the fear, characterized by the behavioral disturbance. So anxiety is not always related to the underlying the condition. It may be caused by the stress that can result from the work, school, personal relationships, or emotional trauma, or financial concern, or any stress caused by the chronic or serious medical condition, a major event or performance, and the side effect of certain medications and alcohol consumption and some of the drugs like cocaine and lack of oxygen. So these are major cause of anxiety. So second topic I want to talk about is the depression, which is different with anxiety. The depression is the mood disorder. So the mood disorder that caused by the persistent sadness. So this is very important part. With the normal sadness is okay, but persistent sadness for the long period of time, this is called depression. And loss of interest, the patient not have interest to anything, to any hobbies, so also called a major depressive disorder, clinical depression, and it may affect how you feel and think and behave, and can lead to variety of emotional and physical problem. So depression and anxiety disorder are major concern in western countries, and because these often hurt everybody life, and interventions based on activities in everyday life are needed. So second part is I want to talk about the sign and symptoms of depression. So having depression lacks and feel different from each person who has it, but some sign and symptoms is common for everyone. So first of all, persistent sadness or sad or empty moods. Okay, so feeling of hopelessness and irritability, or feeling of guilty, or feeling of guilt, or worthlessness and helplessness. So loss of interest, which is the major concern, or pleasure, that the patient cannot feel the pressure, and pressure and hobbies and activities. So decrease the energy or fatigue, and moving, talking more slowly. So it does not mean that if anyone is moving slowly is having depression. So but here we are talking about the common sign and symptoms for. So the feeling restless or having a trouble sitting still, so difficulty in concentrating and focusing, or difficulty in remembering things and making a decision. This is very difficult for them to make a decision. So difficulty in the sleeping, which is one of the other important concerns. So early morning awakening or oversleeping. So this is all can be one of them, or different people have the different symptoms. So appetite or weight change, so thoughts or thought of death, and suicide or suicide attempt. So the second part is the sign and symptoms of the anxiety. Okay, so the anxiety, there are several type of anxiety. First of all, we have to know, first of all, we have generalized anxiety disorder. Second one, separation anxiety disorder. Third one is social anxiety disorder, or specific phobias. And so the some of the common signs and symptoms include the excessive fear and worry. So the patient having a excessive fear and worry. Second one is having a dry mouth and muscle tension, nausea and irregular heartbeat, and difficulty in the sleeping, and cautious or avoidant behavior, or and the last and important one is panic attack. So the common cause of the anxiety and depression, exactly, the anxiety is always related to the underlying the conditions, may be caused by the stress that can result from the work, as I told you, and from the school studying, exam, or personal relationship, or maybe caused by the emotional trauma, or some nowadays the major concern is financial concern. Everything's become expensive, so the financial or economically is having a major effect on this type of disease. So stress caused by the chronic or serious medical condition, and the major event or performance or side effect of certain medication. This is also important. Some medication have the side effects. Also alcohol consumption or drug such as cocaine, and lack of oxygen also major concern. So the treatment of depression is usually involve the combination of self help and talking therapy and medicine. So self-help helping, so you have to help yourself, very important. I will give you the technique how you help yourself, and talking therapy and medicine. So the self treatment, first of all, I'm talking about that self-care steps that might be helpful in some less serious cases. You have to remember that the less serious cases, by for example exercise daily, very helpful. Maintain positive attitude, very important. Get enough sleep, very important. Learn what trigger or increase the anxiety. Okay, so also important, you have to decrease it. And eat well, balanced diet, very important. Nowadays people eating different junk food. So junk food, so you have to eat more fruit and vegetarians, and reducing the meat and oily food, and practice relaxation techniques such as yoga or praying, and stop smoking and consumption of caffeinated drink, because the caffeine which is present in the coffee and tea, which is trigger or stimulate the brain, and increase the heart rate, and at the same time increase the adrenaline in the body. So in this case increase the seriousness of the anxiety. So the important thing here, the second part of the treatment, is to see a doctor if you notice you have this thing. So first of all, you have to see the doctor if you have anxiety is interfering with daily task, or if you have sorry about that, if after previous history of anxiety. Okay, second one, and another type is anxiety is accompanied by the insomnia, okay, kind of lack of sleep, and depression evident. So okay, you have to see the doctor immediately if you have suicidal thoughts or that you have a panic attack. The rest of the video I'm going to talk about the medication or medicine used for the antidepressant, or you can use for anxiety also and the depression. But as I told you this, as I told you before, that this kind of medication you should not take it. You have to take it only by the doctor. So just you have to go to the GP and you have to see the doctor, and the doctor prescribe for you this kind of medication. So antidepressants are classified into different types depending on their structure and how they work. Okay, there are at least 7 types of antidepressant. So first of all, monoamine oxidase inhibitor, one of the type of antidepressant which is very common. They block the effect of monoamine oxidase enzyme, which increase the dopamine and norepinephrine and serotonin neurotransmitter, which is very important in the brain for feeling interesting and pleasure. So isocarboxide, the brand name is Marplan. So the second type of medication we have norepinephrine and dopamine, okay, reuptake inhibitor. So NDRIS, which is a blocker reuptake of norepinephrine and dopamine, increasing the level of norepinephrine and dopamine in the synapse. The genetic name, the chemical name, you have bupropion, and the brand name you have Wellbutrin. SR means sustained release. So another type of medication we have here, so first of all, this one, selective serotonin reuptake inhibitor, SSRI, which is very common medication, prevent reuptake of serotonin. Like we have citalopram, which is very common medication. Silexia is the brand name. So another type we have serotonin and norepinephrine reuptake inhibitor, SNRIS. So the block the reuptake of both serotonin and norepinephrine, which is increase the level of serotonin and norepinephrine in the nerve synapse. So we have the drug like duloxetine and Cymbalta and Erinca. So duloxetine is the chemical name, which is very important. And the other medication we have serotonin antagonist. Antagonist is reuptake inhibitor. Okay, in this case, we have prevent the serotonin reuptake and affect the serotonin binding to certain receptor. Okay, that's by increasing the serotonin in the brain, so increasing the chance for binding to the receptor. So we have nifazodine. Okay, so another last type of medication we have tricyclic antidepressant, which is most common medication, tricyclic antidepressant, which is the work by increasing level of norepinephrine and serotonin. And they also block the action of other neurotransmitters such as acetylcholine and histamine, which is both of them increasing the depression. So the medication name we have here, amitriptyline. So amitriptyline, one of the best medications nowadays using by the people. Thank you very much for listening. I hope this video helpful for you. Don't forget to subscribe my channel and like this video. Thank you. Bye bye.